So the MabCute study was a valuable study. In fact, what it was looking at was the role of extended maintenance in patients with indolent lymphomas who'd benefited from chemotherapy and maintenance therapy before that point. So basically, a large study, almost 700 patients with relapsed indolent lymphoma, that's follicular, marginal zone, and Waldenstrom's. And the patients were treated, they're all relapsed patients, they were treated with chemotherapy and Rituximab, with the Rituximab given subcutaneously. It was permissive with respect to the chemotherapy. And then those that got a benefit went on to maintenance, which was 2 years maintenance, again given subcutaneously for 2 years. At the end of that point, those patients still deriving benefit were randomized to ongoing maintenance to progression or stop. So those are the patients that this question is live in. So you've treated them with chemotherapy, they've had maintenance, and they are still benefiting. Those patients, do they benefit from ongoing treatment or not? So there were two major findings. One was the toxicity. So the interesting thing, which I think many of us were a bit surprised at, was with the ongoing maintenance, you didn't see any difference in toxicity between those patients and those who were just observed. So with ongoing treatment, you don't see an emergence of, say, neutropenia or infections, which some of us might have thought was going to be the case. But I suppose the patients that were going to get those problems got that with the initial maintenance and came off the study. The second thing, which is the primary endpoint of the study, is progression-free survival. And there was no difference in progression-free survival between the extended maintenance patients and the ones that stopped. If you're going to be totally fair about this, from a statistical point of view, it wasn't actually powered to prove that definitively. There were so few events. I think some of the assumptions that were made at the beginning about the size of the trial weren't valid, so the patients did much better than was thought. And if you look at overall survival, absolutely no difference whatsoever between the curves. So it gives reassurance to clinicians and patients, actually, that at the end of their maintenance period, there's no additional benefit from ongoing maintenance, which is an important negative message, if you like. But in those patients where it's thought that you want to continue, there's no additional toxicity. But I think on balance, there's no strong evidence to continue with maintenance. And also, subcutaneous Rituximab, exactly the same side effect profile as intravenous Rituximab, which is reassurance that that's the drug we should be using.